Good afternoon, everybody. In light of time, I'm going to kind of speed through some of the slides because there's some statistics and they're usually kind of boring. But if anybody wants to have access to them, I'm more than willing to share. Which button do I do? So this is where I work. I'm a nurse practitioner at the Mount Sinai Comprehensive Cancer Center. I like to tell everybody this is This is my third and final go-round at Mount Sinai. I actually started my career there. So here's just a couple survivor statistics, that as of January of 2016, it's estimated that there will be 15.5 million cancer survivors. The number is projected to increase by almost 31%. And among today's survivors, the most common cancer sites represented are female breast cancer patients, prostate cancer, and colorectal cancers. So over the next decade, the number of patients, the number of people who have lived 5 years or more since their cancer diagnosis is probably going to increase about 35%. So here's an outline of the cancer survivor statistics in the United States, and you can see how significantly it's increased over time. So this is actually where it all started. This book was published, The Lost in Translation, From Cancer Patient to Cancer Survivor. It was published in 2005, and that's when the focus really started to turn to patients who had completed their therapies and what the next part of their journey would be. And they defined, and we still use the definition of a cancer survivor as an individual is considered to be a cancer survivor from the time of their cancer diagnosis through the balance of his or her life. So here's another graphic that you can see over time how much we've improved in our cancer care and our symptom management. So there's three separate, Dr. Mullen was one who identified three separate kinds of cancer survivors. The acute survivor, or survival period, which is right after the initial diagnosis, the extended survival period of time when treatment is completed, and then the permanent survivor, which are the ones that we really look out for today. So I thought this was a very timely slide. Cancer didn't bring me to my knees, it brought me to my feet. And that was from Michael Douglas, who is a survivor of throat cancer. So just briefly, I think it's important to know that there is a history of what actual cancer survivors were, and it actually started way back late in the 16th century. And it was identified in 1594 when Shakespeare made reference to a survivor being the spouse of someone who died. Then there was in the late 1900s and early in 1968, discussions about survivors related to those who had survived the Holocaust. So as the history of cancer survivorship goes on, in 1982 was the very first Susan B. Komen Race for the Cure. So National Cancer Survivors Day is June 1st of every year. That started back in 1986. Betty Farrell was and still is a nurse researcher that's doing a lot of work on cancer survivors and quality of life. In 1996, the NCI, the National Cancer Institute, founded the Office of Cancer Survivorship. ASCO, which is our professional organization, the American Society of Clinical Oncology, developed a curriculum for medical students to start studying survivorship. In 2004, the President's Cancer Panel was developed, and in 2005, the National Coalition of Cancer Survivorship, along with ASCO, developed the Cancer Quality Alliance. So here we are as close to 2016, where we've had national forums, we've had the Academy of Oncology Nurse and Patient Navigation formed, the National Comprehensive Cancer Network developed guidelines just 5 years ago in 2013. And here we are with the latest statistics of 15.5 million cancer survivors. So I think in follow-up to the last presentation we had, I think it's important for the survivors and the caregivers who've helped them along. And I think here's some interesting facts about that. Most of the American caregivers are unpaid. Most of them are age 45 and older. Most tend to be women. Usually they are family members. And it's the reason that cancer survivorship has moved forward, because of the great care of these caregivers. So on this slide, it lists some of the stressors, and it was mentioned in the previous discussion about stress and the caregiver experience. So there's the difficulty sleeping, trouble relaxing, when you're feeling constantly exhausted and you're dealing with a constantly exhausted family member that you're caring for. So finding ways of feeling empowered is important for the caregiver. Feeling powerless is the #1 contributing factor for caregiver stress. So it's most important for you as the caregiver, these are the top 10, to take care of yourself, eating, sleeping, drinking, and getting exercise. Focus on the things that you can control. Celebrate the small victories that you are able to experience and that of your person you're caring for. And I think the most important is ask for help and accept the help. Sometimes it's very hard for all of us to do, but there are people out there who want to help. Say yes when someone offers that assistance. Join or check out some support groups. Some are online. They're very easy to find. Make sure you get out of the house. I have a lot of appreciation for you that go out to lunch every day. I think that that's important. Prioritize things that give you enjoyment and then do them. Surround yourself with remind yourself that the reason that you're taking care of this person is this is the person that you love, and this is the person who would reciprocate and care for you. And applaud your own successes. Applaud your own efforts and your involvement. I think that's important. So the challenges for us as cancer providers and cancer professionals, we have a lack of survivors from an underserved population. We have a lack of survivors and a lack of patients that are enrolled in clinical trials. We have a lack of governmental funding. We really need to reinforce how to implement basic care for our patients. And for survivorship, we really don't, at least not yet, have a best practice model. So what do oncology professionals need to do? We need to acquire and practice culturally competent care. We need to provide our patients, those who have completed therapies, with a survivorship care plan. That is your map and your journey, your instructions to those physicians that will follow up with you. It should be delivered to you in a separate visit from your final visit with your medical oncologist once your treatment is completed. We also need, as cancer professionals, to respect and incorporate different cultural values. And I know the other speaker was talking about the different types of issues related to eating. And I think it's important for us to recognize that along the way. Here's some signs of companies and organizations that promote cancer survivorship. And I always like to end with this. Back in 2014, the Wall Street Journal did an article on super survivors. And this is actually the line that you could use to scroll in. But if you just go to the Wall Street Journal and hit super survivor, it talks about patients that are using the new immunotherapies and are doing very well for a long period of time. So this is my favorite super survivor. This is a patient who had a stage 4 colorectal cancer, who had an ileostomy, a colostomy, and all kinds of other things, came to us from another area hospital where they had said, I really think you need hospice. We were fortunately able to start him on Keytruda when a new indication came out for the drug. So when he presented to us, he's 49 years old. He came in a wheelchair with his wife pushing him. 3 doses or 3 cycles of Keytruda. He walked into the cancer center. 12 cycles of Keytruda. He went back for reversal of his ileostomy and his colostomy, and they found no evidence of disease. So this is our super survivor who now rides 8 miles to the cancer center and back just for routine follow-up. So thank you very much, and thank you for joining today.
Thank you, Karen. Please join our panel. You know, we don't think very much about survivorship, and I'm so excited to have Karen talk with us today and present on Survivor. So I'd also, we have Dr. Rochelle Clark and Marie joining in our panel here. So if you have any questions in the audience, please raise your hand. I have some from online. It says, where can I find a survivorship plan and what should be included? I think you had mentioned there was no best practices, but is there any kind of resource that they can use?
The first thing you should do is go back to your medical oncologist and request my survivorship care plan. It is now required of all certified cancer programs that the provider give to the patient a list of the drugs and dosages that you received, the amount of radiation that you received, recommendations for future screening. You can also just go to the National Cancer Institute, the NCI site. You can find examples of what other institutions are using, but this is an individualized care plan specifically developed by your care provider for your particular care and follow-up.
Great. Dr. Clark, if you can answer this one, what are the important steps for better chance of survival?
I would say from a psychosocial perspective, it's outlook. Earlier on we had a speaker that was talking about the importance of meditation, the importance of having a positive mindset. And I would say surround yourself with people who are positively impacting your life on a daily basis. Allow yourself to go outside, appreciate nature, and just sit with yourself for a little bit. That would be my suggestion.
Great. What do you think, Karen?
I think it's important that patients fit their treatment into their lives versus their lives into their treatment. That's the advice that I give most patients. And I agree with you very much. It's very, very important to surround yourself with the positive energy. And those people that are negative or distraught for you are the people that you really don't want to be around with right now.
Yeah. Thank you for that. I have another question. How common is survivor's guilt, and what can I do about it? I'll ask you first. Go ahead.
It's actually more common than not. And I was just thinking when I was...
What is it first? Like,
what is it?
First,
It's the guilt for the person, the spouse, the mother, sister, father, brother, that is the one that is who survives the death of a loved one. And it's, I should have done more, I could have done more, I didn't do enough, and that's the survivor guilt. And I was thinking, driving over here today, listening to the funeral for Barbara Bush, that I just... I always thought that her husband looked so frail and so ill for so long. And it actually came across my mind. I said, I wonder if he has some survivor guilt because, his health had always been publicized. And it was much more of a public figure as he failed, before she did. So.
Yes. So, Marie, can you share how has it been for you, even after your loved one passed away? Just your experience right now, and any tips that you can give to other caretakers as well.
You're bringing up survivor's guilt. I think it encompasses a lot, even psychosocially. While my mother was alive, again, it was 8 years that she was fighting cancer. I had a tendency to, as most caregivers, put yourself second, third, fourth, fifth, sixth, seventh, eighth place, and you're really fine with that. This person's fighting for their lives. I'm fine. And what I learned after the fact was it did hurt my mom for me not to step back and let other people help. We didn't have a lot of help, but it did hurt her that help wasn't there. I always did my best to hide stuff so she wouldn't have to go through anxiety, pain, and but a team is always better. I always tell everyone that today. A team's always better than one person. When you're in the hospital, it's not just one person taking care of you in that room, it's a whole team. Make your team at home. Get to know people. If you're a person is isolated, my mother suffered from severe depression and isolation. You make those visits happen. You talk to those family members that are good, positive, and you say, come on by. It seems like a lot. You wish people would just do that, but people don't. Usually they don't know the severity of the situation. My mom was very private. In order for me to respect her privacy, it was a fine balance. And it was, can you come by and look at my mom's car? And then, Mom, they want to say hi to you. And, I would just kind of coordinate that happening. And my mom would feel comfortable, and the guy ended up doing her yard for several years. When we left town for radiation for 2 months, that one connection with someone she trusted, and that one visit was the highlight of her month. But survivor's guilt is so important because the during time, I had a hard time going to a movie, having fun. I felt very, very, very bad if I didn't feel bad. She'd always be in the back of my mind, and I thought it was just so hard to have to feel okay about it. And even after she passed, it was really hard. So some tips: accountability. I would tell my sisters, I have 2 sisters, I'd be very clear. I think I'm going through depression. If I don't call you, it's purposeful. I love to isolate myself, so call me up. And it was because I know that I could hide myself really well. And I can look tough and I can act tough and get away with it easily. So speak out and be accountable. I finally saw a physician. I had everything done and worked on me from my head down to the bottoms of my feet. And I told the physician, I think I'm suffering from depression. My sister is a physician as well, and I said she rated me, and I took a test, and I rate there. So I may not come back, so call me up. If I don't follow up, please, and it was making myself be accountable, because I was aware caregivers, they do that to themselves, and physicians don't think about following up on that too much. That's just not. Psychosocially, I found in primary care, internal medicine, when they didn't know my mom and me, when they don't quite know that story, if I don't express myself really well, they're not going to get that impression that I really need help. And that was how I started off advertising that I needed help while I isolate myself. So create an accountability system. Let your friends, your family, if you don't have that, you let your doctors know. So the next time you go in to get that follow-up on a test, they'll say, so, how are you doing there? Have you done that? And, it forces that accountability.
Thank you so much for sharing that. It takes an enormous amount of courage to ask for help, when you feel like you're Wonder Woman out there. I also commend you also, Marie. As you know, Marie's not only a mentor to other people. You came out of your shell, and after your mother passed away, and became a mentor, as well as a chapter lead. So, thank you so much for really stepping out, and know that you have a family here too. So, does anybody have any other questions? Yeah, in the back of the room, please.
So good afternoon. So along the same lines of guilt and survivors, in the presentation you mentioned the super survivors. Is there any evidence or experience with them experiencing guilt for, surviving these diseases that many of their counterparts or peers, if you will, don't?
I can share one example of 2 brothers that we cared for, both with different diseases, about 5 years difference between them. And the younger of the brother had a curable cancer, but unfortunately ended up having a car accident and dying in the car accident. So the brother really went into a depression. We had some issues about compliance because he was like, I'm not going to continue my treatment, kind of what for. But fortunately, we have a really good psycho-oncology department, and the patient and family was willing to give it a try. But he had, survivor guilt on 2 levels, I think. One from, surviving his disease, and he's still doing fairly well, but then the guilt of the brother.
Mm-hmm. Any other questions, comments? Well, thank you very much. I'd like to, in closing first, we'll take a quick picture together, but, I want to invite you to please, if you haven't, check out the booths there. There might not be people there, but there's some really good information in this first booth, second booth, all of them, so please take what you can. I'd like to thank all of our sponsors, including our platinum sponsor, Lilly Oncology, gold sponsor, Merck. I want to thank you. It's been a long day, but I hope you've learned a lot. I want to thank the presenters today who really took time to put this together today. And, in order to make this educational event help us help you, please fill out those surveys and send them in. And if you're on the webcast, I want to thank you so much for staying on the webcast and hearing all the wonderful speakers and panelists that we've had today. And if you can send in your survey, would really appreciate it. Again, if you'd like to donate today, please make sure that there's an envelope in the front. Please return your name badges at the registration table as well. And we hereby adjourn this symposium. So thank you so much. God bless to all of you. And hopefully we'll see you again at another event. And please come to the gala tonight. If you haven't registered for this evening, bought a ticket, please come. So thank you very much. Oh, this could not have happened with our committee members, so I'd like to take a committee member photo up here after this one. And I'd like to really make a thank you, a very big thank you to Mary Margaret, who did an enormous amount of work for putting this together. So let's please stand and give her a round of applause. Thank you all. God bless.